Good afternoon, and thank you for joining us here today. I am Nita Ludwig, Administrator of the Rock Island County Health Department, and as most of you know, since March, we have been giving regular media briefings and reports on the number of cases of COVID-19 in Rock Island County, along with our partners in Iowa at Scott County Health Department. Early on, our county saw high numbers with outbreaks at some of our long-term care facilities and our meatpacking plant. Thankfully, they have all done a really good job of mitigation, and those numbers have come down. Today in Rock Island County, we have 8 new cases of COVID-19, bringing our cumulative to 1,480 total cases, and unfortunately 30 deaths. While numbers were low during May and June, they have been rising in July. Last week, we reported over 100 new cases of COVID-19. We are now seeing more community spread of this virus, especially among people younger than 40. Although it is summertime and all of us are out and about a bit more, it is especially important not to relax the precautions that we need to take to slow the spread of this virus, which again is frequent hand washing, wearing a face covering when you're out, and keeping a distance of 6 feet or more between you and others. And please stay home if you do not feel well. We are grateful that Governor Pritzker has taken time out of his busy schedule to be with us here today at Rock Island County Health Department. We are honored to have Governor Pritzker with us here today, and please join me in giving him a warm Quad City welcome to Governor J.B. Pritzker.
Thank you very much, Nita, and thank you for welcoming me here in such a kind fashion. I am grateful to be back in the Quad Cities. I want to thank the board president, Doug Vroman, who will be speaking in just a moment, as well for hosting me today. Thanks for all the work that you do and have done over the last number of months. This has been such a difficult time, and you've been helping to guide the people of Illinois through this public health crisis amidst a confusing patchwork of messaging nationally. And this is one of the hardest hit communities, being a border community, so it makes it your job that much more difficult. And I wanted to come here today to discuss with you the very thing that has kept us apart for so long. That's, of course, the COVID-19 pandemic, which continues to spread and remains a part of our lives and will for some time to come. As much as we'd like to, it's not something that we can just wish away. So we have to act responsibly and collectively to protect the people that we love. Let me start by saying that I've made it a priority since day one of my administration to give you all the facts so that every Illinoisan, regardless of political party or geography, gets a transparent view of our decision making. On the whole, Illinois has been a relative success in handling this pandemic and maintaining a positivity rate that's much lower than our nearest neighbors. But it doesn't take long at all to reverse all of those gains and for a trajectory of success to turn on its head. Similarly, success in a state as big and diverse as ours doesn't mean that things look the same across our 58,000 square miles. Our current statewide 7-day rolling positivity average is 3.7%. That's significantly up from where it once was at around 2.5%. Here in Region 2, which includes Rock Island County, that rate is now 4.0%. And it's continuing to head in the wrong direction. That's why we've provided you with all the local public information about the spread of COVID-19 in every county on the IDPH website at dph.illinois.gov/countymetrics. And I'm going to repeat that for all the people who may be watching online, dph.illinois.gov/countymetrics. And of course, you can also find it on your local public health department website. We're counting on city and county leaders doing what they know is right to protect their residents. That includes closing or ticketing a bar that's not adhering to the 25% capacity limit and separating large gatherings when they exceed 50-person limits. as other communities across the state have done, like Springfield and Kankakee and Chicago. The state of Illinois is working with Rock Island public health officials and institutions to provide supplies and testing and support to help you bring down the infection rate before it gets out of control. And we're counting on local residents to hold your elected leaders accountable. Demand that they take action, because if they don't, they'll drive the entire region back to closed bars, closed restaurants, and greater job losses, and even another stay-at-home order. Here's the good news, though. There are proactive things that you can do to help. Wearing a mask. Wearing a mask is like wearing a seatbelt. It's required and it saves lives. If you cross the border to Iowa or Missouri, remember that they have 3 and 4 times our positivity rate. So even if you see someone there that's not wearing a mask, don't think you're safe. Wear your mask. In fact, encourage them to wear theirs. Another thing that you can do, if a contact tracer calls you, please answer your phone. Contact tracing is one of the most important things that we can do to stop the spread. And a contact tracer can also give you valuable information to make sure that you keep yourself healthy. Maintain physical distance, wash your hands, and continue looking out for your fellow Illinoisans. Folks, this is very, very serious. In other parts of the country, people are dying at alarming rates. And it wasn't that long ago we had this challenge in the state of Illinois. In just the last 2 weeks, over 1,600 people died of COVID-19 in Florida alone. That can happen here again. Infections are rising across the nation, in our neighboring states, and right here in Rock Island County. This is our moment to pull together to protect the progress that Illinois has made since the beginning of this pandemic. And we can keep our families and our friends and our neighbors healthy and safe if we do the right thing. So thank you, and now I'd like to turn it over to Doug Vroman. Doug?
Thank you, Governor Pritzker. Real briefly, I'd just like to thank the governor for his support as we work through these issues. This is really a big deal here for us in Rock Island County, especially being a border county. Presents some unique challenges as we have Scott County and Muscatine County directly across the river. There's just a possibility of some confusing messages, some different rules, so to speak. And we really appreciate the support from the state in helping put out a consistent message. I would like to take just a quick moment and thank Nita and her staff for the job that they're doing here in Rock Island County. We're working really, really hard to get that message out and to be a resource for everyone who has questions or concerns regarding this. With that, I'll go ahead and just turn it over to Representative Halpin.
Thank you, Doug, and I'd like to start off first by welcoming the governor back to the Quad Cities. I really appreciate how he recognizes how important the Quad Cities is, and as Doug said, as a border community where we're not dealing just with our own residents, but we're trying to get the message out to everyone in the Quad Cities region. I also want to thank the Health Department for everything they've been doing for the past 4 months, whether it's facilitating testing, getting the data to the states so that Governor Pritzker can make the best decisions he can. Everything they do on a day-to-day basis is helping people keep from getting sick, and hopefully, if they do get sick, not having too bad of a case of COVID-19. What the governor said today is so important. Over the past several months, I couldn't have been prouder of our state and the way that we've come together as a community, from Chicago down to Southern Illinois, and from, here in the west, all the way over to Danville in the east. We've done such a good job of getting the message out about caring for other Illinoisans and doing our best to educate each other as we go through this process and learn exactly what it takes to get through this. And as we sit here today, just 3 weeks ago, we reopened vast portions of the economy, and we were able to do that because we came together, we wore masks, we washed our hands, we kept our distance from each other when we're in the same room. We just need to keep doing that. It's more important than ever as people are going back to work, we've got students going back to school. If we don't want to go backwards, we have to keep caring for each other. And that's the message that I know I want to send, and I believe the governor so eloquently mentioned earlier. We do need to keep going so that we can stay open and we can move forward. I look forward to a day where we can get back to normal, so to speak, but we aren't quite there yet, but we will get there if we all do our part. So thank you all for being here. I'm going to invite the governor back up in case members of the press have any questions, and thanks again for being here.
Thanks, Mike. Happy to take any questions from members of the media. Yes, ma'am.
You just came from Adams County,
I
which
did.
is one of the 4 that is in a warning situation. For Rock Island County, how close are we to that?
Well, the metrics are available. I'm glad you asked, and I hope people will take a moment to go online to look at the metrics. You can look at the Rock Island County Public Health Department's website. You can look at the IDPH, the Illinois Department of Public Health's website, where we show county by county. You can click on any county and see how your county compares to other counties and compares to the statewide numbers. What I would say here is things are not moving in the right direction. We have to make sure that people get the message that wearing a mask, and let me just say it over and over and over again, if I sound like a broken record, it's because you're 80% less likely to get COVID-19 if you wear a mask. 80%. If I told you you could take a pill that would have no negative effect on your health and would only protect you 80% against this virus, if I could reduce the risk, you would take the pill. Why not wear the mask? We are not going to be in this forever. It's just a period of time where we need to make a mild sacrifice, and we want to make sure we keep our families, our friends, our neighbors healthy. This is the moment for everybody to step up to the plate. Wear the mask, keep social distance, physical distance. I hate the word social distance, really. You want to be social, but you can do that with 6 feet of physical distance. Make sure you do those things and care for one another. Check on your neighbors. Call them. If they have an elderly neighbor, don't knock on their door, but call them up and let them know that you just want to check in and make sure that they're okay. And then remember, we have testing available across the state. It has become more and more and more available. I spoke with a governor, I won't name who, just recently was calling me. Actually, I reached out to that governor and I was asked advice about how do we expand testing. This governor said, we're doing 40,000 tests a week. We're doing 40,000 tests a day in Illinois now. And that's up from, very early on, we were only doing maybe 1,000 a day. So I'm very happy about the progress that we've made, and I would encourage everybody in Rock Island to take advantage of the available testing and to make sure that they're, again, following the mitigations that we've set. Remember, wearing a mask is a requirement in the state of Illinois. When you're in public, please follow that requirement. Yes?
As you said, things are getting worse rather than better. And even though you issued a mask mandate for the state of Illinois July 8th, I'm seeing that, for example, last week, Rock Island County Board passed a mask proclamation recommending masks be worn. And then tonight, it's expected that Rock Island City Council will approve the same proclamation. Bars are open, casinos are open. Obviously, if local municipalities are issuing these recommendations for masks, that could be an indicator that not everybody's following your guidelines. Are you considering maybe another rollback of closings until numbers come down again?
Well, let me first say we issued a mask mandate in the state of Illinois May 1st. Yeah,
sorry.
no, I just want to make sure that everybody knows we're not new to this. It's been around since May 1st. It's very much up to local governments and county governments to enforce that mandate. Look, we don't want police, pulling up and stopping people on the street and arresting them because they're wearing a mask. That's not something anybody wants, right? Or issuing tickets like that. What we do want, though, is some enforcement. And that means reminders to people, certainly having the ability to issue a ticket to somebody, having that possibility, or even some sort of a warning. That's important. But even more important is that businesses need to adhere to the capacity limits that are set. Bars have a 25% capacity limit inside. Outside, no limit. Inside, a 25% capacity limit. Many bars across the state are not adhering to that. That is problematic. So that's one area where I'm deeply concerned, and if we saw that a region had to move backward, and remember we're moving on a regional basis now with 11 regions, if a region had to move backward like this region, we would recommend, and we think one of the ways in which we might have to move, depending upon where the outbreaks are really coming from here, is on bars. Another, I might add, is we're very concerned about adult and youth sports, summer sports, right? Where we've seen some outbreaks around the state as a result of those sports. It's sometimes because the kids are getting together at somebody's house and it's a whole big bunch of kids packed into a house greater than the required limit on gatherings. And sometimes it's because of the interaction on the field. I think you may have seen some information today in the news about the Florida Marlins, where they had 2 people who tested positive on the team, and then they went ahead and said, well, they're going to go ahead and play. That's a real problem, I think. So we're going to, we do not want kids to catch COVID-19 because of sports. Neither do we want adults in those settings. So those are 2 of the ways that we might move to put some more mitigations on to lower the exposure that people have to COVID-19. Yes, sir.
Quick kind of two-parter. What impact does county going into that warning stage have on the conversation about opening schools again, going back to school? And what's been your conversation, your office, with the IHSA and fall sports?
Mm-hmm. So let's talk about school openings generally. All of this information needs to be taken into account by local school boards, by superintendents, by teachers, by parents in the planning for opening in the fall or next month for many. And so that's why we're providing so much information. We gave guidance to schools. We have 4,000 plus schools and 800 plus school districts across the state. They needed to know what are the parameters. You can't dictate to every school how it will work because every school works a little differently. Multiple buildings sometimes, portions of buildings that are not in use, the capacity in each building, how many kids are actually going to school at any given time in that building. Those are all things that need to be taken into account at each local school. So we're letting schools make those decisions. Many of them, most of them have gotten the input or asking the input of parents, of teachers, of the entire community sometimes, and certainly the school boards. So we want them to follow the information science recommendations that doctors have put out for how to do that safely. With regard to sports, IHSA has said that they're going to get out of the business of this in the fall. That's what it appears that they're saying. And I'm, deeply concerned, frankly. I mean, I've seen other countries have actually opened up schools and with no mitigations around sports. And guess what? There's been an outbreak among the kids who are in sports. So I'm concerned about this. It's not something that we've issued a mandate about at the moment, but it is something that I'm deeply concerned about and we're watching very closely. Look, this is not going to be like a fall like any other that we've seen. The school semester is just going to be different. People are going to have to expect that, and they're going to have to remain flexible, parents, teachers, students, everybody, because This virus has been unpredictable. I think we've seen that. Was a spike very early. We saw this thing getting out of control, and then, it seemed to come down. Now seems like a second spike going on in certain areas. There are rising cases across even areas like Illinois, where we've, I think, done a relatively good job. We can't let it go. We have to stay on top of this thing. It doesn't go away. It's not going away. Until we have a vaccine or a very effective treatment, it's not going away. So we all need to be vigilant. We all need to wear masks, and we all need to pray for the researchers and the scientists who are working on a vaccine or a very effective treatment. Yes. Yeah.
Following up on the IHSA, so August 10th is the first official day of practice, and then I think a month from tomorrow would be the first official high school football games to be played.
Yeah.
So as we talk to you today, how likely is it for high school sports to take place in the fall of 2020?
This is the problem with this virus. It's very hard to project even several weeks in advance. And I know that's confounding for all of us, but it's true. And as we see increasing positivity rates, you don't want to open up new areas where people can get infected. We drove our positivity rates down a significant amount. At the height, 23%. At its low, about 2.5% statewide. And as you start to see it tick up, what you recognize is that R naught, which is the exponential factor, can take over. It is not difficult for a state to move from where we are to where Arizona is. You have to stay on top of this thing. So, look, I can't tell you what the odds are. I can't tell you what's going to happen August 10th or any date in August yet. What I can tell you is we've issued guidance for what we know right now, but we're all going to have to keep watching. And I've tried to set metrics so people could at least have a sense for where are we going to trip the wire that's going to cause us to have to pull back.
Is that their decision then? You have to say it's up to them to make that decision?
Right now, the decisions are being, made by both the IHSA and by local schools about what they intend to do, and by parents. Parents I think, can make and do make good decisions about their own kids and whether they should be playing.
We have time for
Sir.
2 more questions.
Governor, are testing kits that are available to the state being sent to other states that may be more in need at this point, or to neighboring states?
We have not done that yet, and it's not something that I've currently got planned. I do recognize that there's a desire by other states to have more testing supplies. We've done a good job in Illinois of acquiring testing supplies, and just to maybe give you the language that now is being used around testing, there really aren't any testing kits anymore, right? It's just what we've got is swabs, VTM, which is the thing you put the swab in, the liquid in a vial, and then it gets plugged up and it gets sent to a lab. And then there's, there are chemicals that the lab needs to have available to them. Those are all points of supply chain that can be bottled up and difficult. The problem that's currently occurring for many other states isn't swabs so much, and it isn't the VTM that keeps the swab, stable, but rather the testing capacity at labs across the nation. There are only so many machines. There are only so many technicians who can run those machines for so many hours during the day. There are large national laboratories that are unable to keep up. And so in some places, you take a test, and in Florida or in other places where they're just, they've got to do so much testing because they've got so much positivity. Those tests are being sent to those national laboratories. The result is the national laboratories are once again overrun, as they were at the beginning of coronavirus. And so it can take 7 to 12 days to get a result back. Frankly, that's too long. It shouldn't take that long. We, in the state of Illinois, built up our state lab capacity. We only used to be able to do 200 tests a day at the beginning. We're now able to do 8,000 tests, 6,000 to 8,000 tests a day. in our state labs. We're basically busting at the seams in our state labs now, 3 of them, Southern Illinois, Central Illinois, Northern Illinois. And then we've got hospitals, other medical institutions that have machines, and we're working with them to use every bit of their capacity, which typically has been used for just their own patients, but we're now having them run tests for many more people. And then there are other private labs, like the big national ones, but they're local, commercial private labs, and we're working with them, contracting with them to make sure that we get our tests back in 2, 3, 4, 5 days, a reasonable period of time, as fast as we possibly can.
Governor, you speak about positivity rate in the state, and obviously as the coronavirus has spanned on, we've looked at new daily cases, total deaths. Is positivity rate now the statistic you're focusing most on?
There really are, I mean, look, I wake up every morning and I look at these numbers, and the first one I look at is the deaths. And I realize that that's a lagging indicator, but it's the thing that moves me most. It's the thing that is most troubling, to be frank. But the other 2 measures are positivity rate, because that tells you for a given population what percentage of people at a given moment likely have coronavirus. It gives you an idea. It's like a sample almost, because the reality is that when we report 1,500 positive tests a day, someday, that doesn't mean there are only 1,500 people that got it that day. There are just 1,500 people that were tested that day that have it. There are lots of people who get it and don't get tested that day, or maybe ever. And so I just want to separate. So positivity is a number that we look at because it gives you an idea of what direction you're going. Are fewer people getting it, more people getting it? By the way, as we've increased testing, we've increased the number of cases that you uncover. Just even if our positivity had stayed at 2.5%, 2.5% of a larger number of tests is a larger number. So that's one. But the other one is hospitalizations. Because it's extremely, first of all, anybody that shows up at a hospital and needs to be hospitalized, that's for sure a case, and it's a serious case. I mean, being hospitalized is a serious thing. So we look at that partly because again, it's a test of how bad is it, and the other reason it's so important is because our hospitals have limited capacity in the state. And that's the thing, you saw that we built out McCormick Place in Chicago because we didn't know at the beginning of this thing, we could have turned into New York, and we would have used that space. We didn't. We ended up not using the space. Thank God we've kept it warm, for the idea that, God forbid, we head back, to a place where we might need it. And the same thing around the state where we have contracted for facilities. But hospitalization rate is also hospitalizations. We know how many hospital beds we have in the state. You can increase ICU capacity a bit by doubling up if you need to. We don't need to today, and our ICU beds are not bad at all in the state. But hospitalizations, positivity rate, those are the 2 things that I pay most attention to.
Thank you, everyone.
Thank you.
You had any Whitey's yet today?
Any what?
Whitey's ice cream?
No! I have to say I've only been here for about 15 minutes. So
They're doing a good job with the masks.